February is American Heart Month. According to the CDC, heart disease is the leading cause of death for men and women, and every 33 seconds, one person dies from cardiovascular disease. Raising awareness and understanding how heart health can impact you is the first step, and for that, joining us this morning is Dr. Parikh-Casanova from Teladoc Health. Doctor, thanks for joining us this morning, and I want you to start by telling us how mental health conditions like anxiety or depression can affect our heart health as well.
Sure. Thank you. Thank you for having me, and thank you for highlighting the importance of this connection, number one. So I think that it's important that viewers recognize that our body reacts to stress pretty much identical. There's this, if we're in front of a bear or if we're in front of a set of unpaid bills, our body sets off a cascade of hormones that sort of react to that stress. And so recognizing that any form of stress is going to set off that cascade is very important, anxiety and depression being one of them. So cortisol levels will start to rise, our blood pressure starts to rise, heart rate starts to rise, and these are all our body's way of trying to handle this stress. And then we have to deal with that high elevated state and then properly manage it so it doesn't lead to heart disease. So that's kind of the basic correlation, yeah.
I'll take the unpaid bills over a bear, but
Yes.
what are some warning signs to look out for if our mental health is impacting the heart?
Yes. So high blood pressure, they call it the silent killer. So really kind of watching your blood pressure on a regular basis. I encourage patients to at least check it, a couple of times a week. And then whenever you do check it at various times of day, because that time of day can also cause elevations and spikes. And so it's important to know kind of what your body's doing throughout the day. So that's one. Your heart rate is another thing. If you start noticing palpitations frequently, if you start noticing chest pain, shortness of breath, difficulty sleeping, these are all signs that potentially something could be off. A high anxiety can interrupt, the quality of your sleep. You're not sleeping the full 7 hours that we recommend that our body needs to kind of rebalance everything. Yeah, so those are some signs.
Yeah, and for our viewers out there, they're probably thinking, well, how do you recognize a mental health issue, and then how do you manage it to protect their heart?
Yes, yeah. So recognizing mental health issues, the best way is to sort of be very mindful. You hear about being mindful in your behaviors and your techniques. So journaling is nice. Meditating, just kind of having a quiet moment to let your mind sort of rebalance itself and recognize the cues easier. I think that if we take a moment to just pause and kind of see which cues set us off is very important. Physical activity, exercise really helps, reduce stress because it gets that blood flowing and pumping and kind of releases that pent up energy. Making sure that you spend time, praying, hanging out with your friends, all those things that sort of release that stress and anxiety are very important as well. Yeah.
And what should someone do if they do recognize that their mental health is affecting their heart?
So the first thing is to connect with your healthcare provider. I think that I'm in primary care, and so I think, speaking with your primary care physician is the first step. Because they can help you sort of navigate your symptoms. Let's say, if you're having palpitations, what is the origin of this palpitation? Is it anxiety? Is it depression? Could it be a hormone imbalance? Could it be a lack of sleep? And so sort of targeting where is the source of this symptom coming from, I think is the most important. So definitely connect with a healthcare provider so we can navigate that. In primary care, I feel that that's sort of the nice thing about it. We sort of help patients guide which avenue needs to be focused on first. Yeah.
I have this heart right here that says stress less, and that's what I do when I give it a squeeze. Thank you very much, Doctor, for joining us this morning.
Yes, you're welcome. Have a good day.